Well, it's understandable these days if you're nervous about going to see your doctor, but you do not want to ignore your health during that pandemic. Isn't that right, Nurse Barb?
Malou, you're so right. In fact, I've been seeing patients throughout the pandemic, mostly emergencies, but now we're starting to see those annual physicals.
All right, so what should people do? What do they need to know?
Well, I want to reassure people that most doctors' offices have very strict protocols in place to help you feel safe and keep us safe. So when you get there, you'll have a no-touch temperature taken. They'll screen you. They'll ask you a bunch of questions. They'll make sure you're wearing a mask and all of us are wearing masks. We're also going to be wearing gloves when we see you. You will be surprised that no one else is going to be in the waiting room, or there may be only one other person. We're going to be disinfecting everything that you touch. Any high touch surface is going to be disinfected afterwards. And after you leave, we're going to disinfect everything, counters, chairs, anything that you've come into contact with, to protect us and to protect the next patients.
All right, so those are all great things there. And so you also want to make sure that you don't ignore anything like your body, right? Like it's things that you're feeling, like if you're lightheaded or, just other symptoms.
Right. And so many people have been at home suffering. They're having chest pain, shortness of breath. Maybe they have a child at home who's having diarrhea or a high fever, and they're afraid to talk to their healthcare provider. My message to you is don't delay. If you're having any severe symptoms, do talk to your healthcare provider. And if someone is really sick, do call 911, because the emergency rooms are set up to protect you and to take care of you.
All right. And what about our mental health lately? I mean, it's hard. It's a struggle sometimes, it's like emotions are going up and down and we're nervous. Some people are having panic attacks. Like, how do you know if you're having one?
Malou, I'm so glad you brought that up. I've had so many patients tell me that they only used to have a panic attack maybe once or twice a year. And for those of you who aren't sure what that is, it feels like your heart is racing and it's going to pump out of your body. You might be short of breath. You might be feeling like that. You're having racing thoughts that you can't get rid of. This can last for 45 minutes, sometimes an hour and a half. It's because you're having a flood of stressful hormones. Many people who are having a lot of anxiety now are seeing a big increase in their panic attacks. I'm also seeing a lot of people with depression. Your mental health is just as important as your physical health, so do seek help.
Yeah. Or if you know anyone who is suicidal, make sure you call. I know there's a hotline too that you can call.
There is a hotline. The suicide hotline is on every website, but don't delay. If you are feeling really bad, it is time to see a healthcare provider. I know I'm seeing patients who were doing really well until the pandemic started, and then their underlying issues are really getting the best of them. But don't delay seeing a provider.
All right. Just like you said, bottom line, do not delay seeing your healthcare professional if you're not feeling great or if you're feeling some other symptoms, right, Nurse Barb?
That's right. And we're here to take care of you, and we're taking care of patients. And I want to tell everyone, I've been caring for everyone since the pandemic started. No one in my office has gotten sick. We have not transmitted or acquired the virus from anyone because we know how to practice infection control. And as you say, Malou, wash your hands, wash your hands, wash your hands.
Yeah, it's always great to talk to you, Nurse Barb. You make us feel so much more comforting. So thank you very much.
You're welcome. Be well.
Take care.
Thanks. Bye-bye.